Hello, and welcome to Health Talk, a show where we dive into common health challenges with local experts to bring you the information that you need to live your best, healthiest life. My name is Dr. Desmar Walks, family physician and local health authority for Austin-Travis County. In today's episode, we'll be discussing dementia and aging with a special guest who is a medical practitioner who specializes in brain health and, in particular, cognitive disorders such as Alzheimer's and traumatic brain injuries. In the U.S., nearly 1 in 10 adults aged 65 or older have dementia. The rate of occurrence is on the rise. It is estimated that by the year 2050, the number of people over the age of 65 with Alzheimer's will nearly double. Older Black and Hispanic Americans are disproportionately more likely to develop Alzheimer's and other dementias. Among all races, women are nearly 2 times more likely to be affected by Alzheimer's disease than men. These numbers show the relevance of this topic for all of our listeners now and going forward. Our guest today, Dr. John Bertelson, is a behavioral neurologist working at UT Health Austin's Comprehensive Memory Center. He has extensive experience in the diagnosis and management of patients with Alzheimer's disease, Lewy body dementia, and other neurological disorders of cognition. Dr. Bertelson is an assistant professor of both Dell Medical School Department of Neurology and the Dell Medical School Department of Psychiatry and Behavioral Sciences. Welcome, Dr. Bertelson.
Thank you, Dr. Walks.
So, Dr. Bertelson, let's start by defining dementia. Can you explain what dementia is and how it differs from normal age-related memory loss?
Sure, I get this question every day. People always ask, do I have Alzheimer's? Do I have dementia? Do I have both? Do I have either? What's the difference? And dementia is a symptom of a disease. Dementia means that there's been a cognitive change that now results in one's difficulty or inability to do things they used to be able to do before. Because of Alzheimer's or stroke, they're unable to drive safely, unable to manage their medications, unable to make safe decisions. These are symptoms that would indicate someone has developed dementia. There are some changes that we see with normal aging, a little forgetfulness here and there, struggle to remember a name, misplace your keys every now and then. The difference between dementia and normal aging cognitive symptoms is the severity and the persistence. People who have, especially of Alzheimer's disease, they're forgetful every day, struggle with words every day, which is compared and contrasted rather from people with normal aging changes who have symptoms like this intermittently.
So is dementia hereditary?
Dementia is somewhat hereditary. I think of dementia having 3 general causes. Age is probably the biggest risk factor, but there's age and genetics and lifestyle. And it's probably a combination of all 3 of those factors that work together with a formula that we haven't figured out that will increase or decrease one's risk of developing Alzheimer's based on how those variables play out.
What are some of the early signs and symptoms of dementia that family members should be aware of?
So early signs and symptoms sometimes are really only appreciated in hindsight. So I saw a patient today whose daughter first mentioned that they noticed symptoms when the patient's dog passed away, and how much they struggled with memory and thinking after that time. But then we talked a little bit more, and it turned out that they were actually forgetful for several years before that. So early symptoms would be more regular forgetfulness of words, more regular misplacing of things. But it's subtle. It can be very difficult in the very beginning to determine what's normal aging or what's the very beginning of something like Alzheimer's. Sometimes it takes time to determine, is this increasing in frequency? There shouldn't be a rapid acceleration in frequency or worsening symptoms in normal aging, whereas with Alzheimer's disease, if you look months on end, especially 6 months at a time, you definitely would see a significant change, or you should see a significant change 6 months to 6 months in someone who is on the road to developing Alzheimer's.
What are some of the common misconceptions about dementia that you'd like to address?
Common misconceptions about dementia. I think the first one is that dementia and Alzheimer's, those are not exactly the same thing. Dementia is a symptom of Alzheimer's, but dementia can be a symptom of brain injury or stroke or something called Lewy body disease, frontotemporal dementia. So there are a lot of diseases that can cause dementia. Just because someone has dementia doesn't mean it's Alzheimer's disease. And conversely, Alzheimer's disease begins perhaps decades before people have any symptoms. You don't wake up one day with Alzheimer's disease, not have it the day before. These proteins accumulate over the course of many years. And so it's really important to consider Alzheimer's disease as a long-standing condition that may last for 20 years of someone's life, and it's not necessarily just the past 3 or 4 years of someone's later years.
So can someone with dementia still have a good quality of life?
They absolutely can. People with dementia can have a good quality of life. It may get harder, they may need more support, but people with dementia can enjoy their family, can enjoy their friends. In the early stages, may have independence still about driving, even on their own, may be able to go shopping and travel and whatnot. My goal, as we were talking before this show started, my goal with my patients is to maximize their independence and quality of life, as long as is keeping safety in mind, of course. But there is a lot of potential for enjoyment of life. And I think it's important, I'm glad you asked that question, because people need to realize that just because they may get a diagnosis of Alzheimer's or dementia on a given day, it does not mean their life is over. They still have the opportunity many times for a lot of literally good years to come.
That's good news. What advice would you give someone who suspects that their loved one may be showing signs of dementia?
It's hard. So if someone is suspected to be developing dementia, I think it's important to take that person or convince them to go to their doctor, usually their primary care. Hopefully this is a doctor who's known them for a long time, who can evaluate them for for many things, but an important one is an alternative to dementia. Just because someone is older and forgetful, it doesn't mean they're on the path to developing Alzheimer's or another form of dementia. They may be sleep deprived. They may be taking sedating medications. They may be drinking too much alcohol. There are a lot of reasons. They may be depressed. So there are a lot of what we call reversible factors that one should consider before one assumes, well, they're old and forgetful, therefore this is Alzheimer's and there's nothing more to do. Mm-hmm. It's really important both for the specialist and for primary care to look for those reversible processes.
That's so true. What legal and financial considerations should be addressed when a loved one is diagnosed with dementia?
So I'm not a lawyer, as you know, so I can't give the listeners any official legal advice, but I would encourage really everyone to speak with their loved ones about their wishes for the future. Heaven forbid, no one knows when there might be a car accident or a serious injury that would suddenly take away our ability to make decisions for ourselves. And so I think it's important to tell our loved ones what we would want in certain situations, or appoint them to be our what we call power of attorney. We should get our wills lined up. We should do what we need to do, planning for the future while we have that ability to do so. It does get harder when someone has dementia to make these. Sometimes it gets harder to make these decisions appropriately, safely, and in the same way they would have done prior to developing their disease.
So true. So this is something probably that's recommended for anybody, not just somebody with dementia, right?
Absolutely. We all should be thinking about our futures and planning for the future.
Are there any unique challenges or considerations when caring for a younger person, say someone under 65 with dementia?
There are. We call people who develop, especially Alzheimer's, before the age of 65, there's a different name for that. We call that early onset Alzheimer's disease. And there are a lot of different considerations. They may still be working. And how can you extract them, or how can they extract themselves from their job safely without harming anyone, especially if they're in a line of work where people can be hurt if they make a mistake. So we need to consider their employment. They may still have kids at home, and how do you approach telling someone who's, say, in high school that their parent is developing Alzheimer's disease and say they're maybe in their 50s. They at that age, before 65, they likely don't have Medicare. And so we need to think about insurance factors that we take for granted for someone over the age of 65. And that can be quite challenging. We kind of know the rules, what Medicare does, but the private plans, they aren't as consistent in approving tests, approving medications. And so it really, to the provider especially, can be very challenging to navigate offering and providing the right treatment for patients if they have non-Medicare sort of plans.
So how can family caregivers best support their loved ones during the different stages of dementia?
Right, so that's wow, you've got questions that we could spend a whole hour on each one of them. But as you said, the family caregivers would try to care for people in different stages. And so kind of by definition, there are different needs in each of these different stages. In the early stages, when their loved ones might still want to live at home, it might still be safe. So in those stages, it might be a matter of making sure they can drive safely, perhaps by getting a driving test. Make sure that they don't become victimized by financial predators. These people are getting scams are getting so sophisticated that even people who don't have dementia are frequently being taken advantage of. But once someone has Alzheimer's or another form of dementia, they're much more susceptible. So protecting their assets, protecting their estate, making sure that they eat. People with Alzheimer's are generally quite forgetful, and I've got patients who forget to eat. I've got patients who think who ate but forgot they ate, and so they may eat twice. And some people say, well, I have just one beer, one scotch, one whatever a day, but they forget, and so they might drink over and over and over again. So in early stages, I think it's a matter of helping, as much as possible, helping them age safely in place. As the stages go on, as the disease progresses, when people often aren't able to live alone anymore or live with their spouse, need to think about what alternative living arrangements might be appropriate. What's affordable. There are some great places out there, but some of these places are very expensive. Can the kids who might still be working, might have their own children, can they take their parents in and care for them at home? So it's really difficult across the board. But I think if I want to try to answer that globally, I would encourage families to consider their loved one with respect throughout the course of the disease, because it's still their parent. They may have a role reversal. The child is parenting the parent, which is a switch from before. But I think maintaining that respect for their loved one, it's critical. And even people with dementia, they realize that. They may not understand your words, but they can understand your body language. Mm-hmm. And people will pick up on being condescended and other sort of strategies that may happen if you're stressed. As a very frustrated caregiver, people, despite the best intentions, may lash out. There may be arguments, but I think also trying to realize that people with dementia aren't doing this intentionally. Mm-hmm. Just because they accuse their loved one of stealing their keys, it doesn't. They are only doing that because of the brain disease. It's not because they're trying to be malicious or nasty towards the kids. So again, that's a long answer, but it really depends on, in some respects, the stage, but really it's showing respect at all stages of disease.
Yeah, and it's such a long process, right?
I've
had many patients that, they themselves become very fatigued and stressed and frustrated and then remorseful during the time that they're trying to care for a loved one. And so with that, do you have any tips for caregivers as they're trying to manage those challenging behaviors?
Well, I'm glad we chatted up front before this started, because we were talking about self-care.
Yeah.
And I think that's really a key point, which is a caregiver needs to be strong and care for themselves. And if the caregiver is worn out, sleep deprived, not eating, depressed, struggling in their personal relationships, they can't be the best caregiver for the loved one. What I tell patients and families when they come in the room, I say there are always at least two patients. There's the patient with the disease and the caregiver who has their own different needs, and then their needs are just as important, just as real. And I tell each of them, but I focus on the caregiver by saying that they need to care for themselves just as much as they're caring for the loved one. It's a house of cards. If the caregiver is trying to do everything and it's just the caregiver and the patient without any local family, the caregiver pushes themselves to exhaustion, they fall, they break a hip, they get sick, they whatever, and then suddenly they're in the hospital and their loved one with Alzheimer's is potentially alone. And then that can be an immediate catastrophe. Mm-hmm. So they should care for themselves not only for their own benefit, but it really benefits their loved one with dementia if they remain healthy and strong.
As you're saying that, it occurs to me it's kind of like put your mask on before you attend to the person sitting next to you, really. And so would you recommend organizing a schedule so that there's more of a routine for somebody that's caring for someone who has dementia?
Routines are very helpful for the caregiver. I think of it in particular for the patients, though. People who have Alzheimer's, they're forgetful, but many times they can learn a routine eventually. And so as scheduled and as regimented and as predictable as their life can be, patients with Alzheimer's often will function better. In fact, they can even remember, okay, Tuesdays are lunch days with the neighbors, and Fridays we might go bowling or whatever it is. And they can look forward to that too. Mm-hmm. And so routines and schedules are very important for the patients. And I think probably for the caregivers as well, because they can know what to expect and they can budget their energy. Mm-hmm. And they can say, okay, well, today's gonna be a tough day because I've got 5 appointments and I've got to work and soccer practice for the kids or whatever. But I know I get through all this on Tuesday, and Wednesday is light. Mm-hmm. I can catch up. Mm-hmm. So and as I think about it, using a schedule can be helpful to help prevent the caregiver from getting burned out. Mm-hmm. And burnout is such a big problem in healthcare, but it's even a bigger problem with caregivers of patients with dementia.
So are there some ways to ensure the safety and well-being of the patient that has dementia?
Yeah, safety is really a critical point, of course, and safety concerns vary so much between patient to patient. I've had patients who really had very mild disease, but they became paranoid that people were spying on them, people were trying to poison them, and so they cover all their shades, they put boxes in front of the doors, they do things to thinking they're protecting themselves, but putting themselves in a dangerous position. With certain dementias, patients may not realize who their spouse is. They may think, oh, that person looks like my spouse, but it's a duplicate. Mm-hmm. And so they say, well, where's Martha? You look like Martha, but I want the real Martha. Mm-hmm. And they can get angry. Mm-hmm. And so they can be not only a danger to themselves, but they can be a danger to their spouse, thinking this is an imposter. Mm-hmm. And then we talked about driving earlier, and it can be very difficult to convince someone with Alzheimer's that they need to stop driving. One of the hallmarks that I find with Alzheimer's is that patients often don't realize how much of a problem they have. I tell families they often forget how forgetful they are. And so they truly think they can drive safely. They forgot that they got lost driving the other day. Mm-hmm. They forgot that all these dings on the car because they ran into things they don't even remember running into them. And so driving is one of the most, I think, common challenges I have in my practice with respect to reducing problems with danger and improving safety.
Yes, that's so true. What factors would you say in healthcare are preventing individuals and families from getting the proper diagnosis and treatment for dementia?
Yeah, there are a lot of reasons why people don't get that right diagnosis and treatment. And I think it often comes down to a couple things. One, I might add to that as we talk. One is isolation and denial. Someone who lives alone, if they don't have family nearby, there's no one who realizes how bad things are getting. They don't realize that the patients are having accidents or that they're forgetting to eat until there's really a crisis. So some of it is isolation. There may be some denial. Families may not want to face the fact that their loved one has a disease that will progress. The patient may resist being taken to the doctor. So even if the family realizes there's a problem, the patient may resist going in. But I think one of the biggest and most unfortunate challenges is socioeconomic. It's access to care, whether that's insurance or having specialists in one's community. But minority populations, unfortunately, get diagnosed, if they get diagnosed at all, often get diagnosed later in the course of disease. And there are a lot of reasons why that might happen. But ultimately, it does come down many times to access to care.
So are there programs that can be accessed for patients that don't have the financial resources for getting the care that they need and getting the medications that they need?
There are resources. Medicare, as people may want to complain about it, though, it does pay for at least 80% of the doctor's appointments and visits and things. And so, yes, for some people, even that 20% may prevent them from seeing doctors. But I think taking advantage of all of Medicare services really is an important step. Using community-based resources, volunteer programs and things, getting help from churches and taking advantage of support groups, many of which are either free or subsidized, especially if people have need. So part of it is just realizing what is out there. And there are free services, say from the Alzheimer's Association hotlines and 1-800 numbers that people can call if they need help. So I think in some respects it's a matter of realizing what resources are out there.
Thank you. So are there any promising new treatments? I know we had a little bit of a discussion, but I'd like you to say it again for our listeners, because dementia can be a scary diagnosis to hear coming from a provider.
Right, yeah. This is really an exciting time in terms of dementia care. Mm-hmm. A year ago, the first fully approved FDA drug that what we call modifies the disease, meaning it gets to the root cause, at least what we think is the root cause of Alzheimer's, amyloid accumulation in the brain. Amyloid is a protein. And so less than a year ago, about a year ago, the first drug was approved to slow down the progression of the disease in people who are diagnosed at the mild cognitive impairment or treated at that mild cognitive impairment or early Alzheimer's stages. Another drug was in the news just 2 days ago in that an advisory committee with the FDA recommended approval from the second, they're called monoclonal antibodies, or antibodies that target amyloid protein. These are the first fully approved drugs to treat Alzheimer's for 20 years, or about 20 years. So we really are entering a stage where it's that much more important to diagnose, because we now are having treatments that can really make a difference. Now the treatments are infusions, and there are complicating factors to consider with them. But the first step is to see the doctor, to learn what the disease is and figure out what the treatments are, and ultimately realize that we do have some reason for hope, that it's not a disease that will progress despite everything we try to do. We do seem to be able to slow at least Alzheimer's disease down if caught early enough. We're not as far along with some of the other dementias, Lewy body dementia and frontotemporal dementia, but we really are making strides with treating Alzheimer's disease. And I think this is the first wave of the future in treating Alzheimer's, which probably, as we discussed also earlier, will be like HIV, in that we might attack the disease from multiple angles. and hopefully get to the point where someday, and hopefully in our lives, we can either halt the disease, or especially if we treat people early enough, say before they have symptoms, possibly prevent them from getting Alzheimer's disease at all.
Wow, that's exciting, isn't it?
It would be very exciting,
Yeah.
very exciting.
Because the cost, right, of not having the ability to treat somebody is pretty astounding, right?
Yeah, the cost to the government, the cost to healthcare entities, the cost to patients and families is astronomical. Hundreds of billions of dollars a year in indirect and direct costs. And I don't remember the number; it may be higher than that, but it's incredibly high, and it unfortunately can escalate because the caregivers who may be working may have to leave their job to care for their loved one, and so not only they've got expenses that are accumulating because of that disease, their income drops because they have to give up their job, and so costs are a huge problem in this condition, Alzheimer's and other forms of dementia. So sure, if we can prevent people from getting Alzheimer's disease, that would be such a profound benefit to society, not just the individual, but society as a whole.
Yes, and we were talking about how we can promote healthy brains and talked about diet and exercise and sleep. Tell me a little bit more about the science behind those claims.
Yeah, so we're learning more and more about the risk factors for Alzheimer's disease. And we've got risk factors that we can modify or control and risk factors that we can't. Hearing loss, we didn't talk about that earlier, but hearing loss appears to be a pretty significant risk factor for the later development of Alzheimer's disease. Kind of at a very high level, what appears to be good for the heart is good for the brain, and vice versa. So we know that diabetes and high blood pressure, high cholesterol, smoking are all significant risk factors for vascular disease. And they all appear to be, to some degree, risk factors for the development of Alzheimer's too. And so it's important to try to live a healthy lifestyle. More and more articles are coming, especially recently, looking at processed foods. And the more processed a food is, the more harmful it appears to be. Conversely, the more natural it is, the healthier it seems to be. And then sleep. We know that in the deep stages of sleep is when the brain flushes out amyloid protein. And so people who are sleep deprived, who may get 3 or 4 hours, or even 5 hours sometimes, don't get enough of deep sleep, they are likely slowly accumulating amyloid within the brain. And people with sleep apnea, who may wake up throughout the night and never get into the deep stages of sleep, even if they sleep 10 or 12 hours a night, they may also not be getting the restorative benefits of sleep. And so sleep apnea, which I didn't mention, is a risk factor for heart disease. It appears to be a risk factor for Alzheimer's as well.
Thank you so much, Dr. Bertelson. Great conversation, great information, and thank you for joining us today. That's all the time we have for today's episode of Health Talk. Thank you to KAZI 88.7 and to St. David's Foundation for their support of this program. Until next time, take care of yourselves and each other. This is Dr. Desmore Walks signing off. Be well.